Well, first of all, the first part of the test is to check out the heart at rest. And what we then do is a baseline ultrasound of the heart, where we're looking at heart function, valve function, and measuring pressures inside the heart. Then we take 7 separate images in which we are looking specifically at the left ventricle, and we will be using those images as well as post-exercise images and making the comparison. We then exercise the patient on the treadmill, and importantly, we start very gently. What we have to do is to get the patient really relaxed and able to start walking very slowly, and that is an important component. And then what happens is that over every 30 seconds, using our protocols, we slowly increase the incline and the speed of the treadmill so that we can slowly ramp up, progressively putting the heart initially under a very minimal strain, a mild strain, a moderate strain, and then in the last couple of minutes, that's the time that we are actually putting a lot of stress on the heart. Generally, because we gauge and adjust on an individual basis the protocol of how fast and how severe each exercise is, through this, what we're aiming for is an exercise which then lasts between 6 and 12 minutes. And during that period of time, we're constantly measuring a number of parameters. Importantly, we're taking serial ECGs, heart rate, blood pressure. We're constantly monitoring the patient for symptoms, both in terms of how they're doing, but in addition, the development of any symptoms such as shortness of breath, knee or leg discomfort, or chest discomfort. The beauty about our protocols is that we can adjust for that, so that we can, on those patients that can exercise, do a very, very gentle exercise, such as quite an elderly patient that is still quite ambulant, but is a little frail. In addition, what we can do is to do the average relatively unfit person, going to the weekend warriors that are really in lycra, who feel that they're really quite fit, going all the way to elite athletes. In regards to other protocols, there is a standard protocol that everybody has to use, and it's one in which there is a 3-minute increment, and that's equivalent to climbing upstairs 3 at a time. And each of these increments, it's a little bit like all of a sudden somebody next to you takes off and sprints. And if you're in the middle of an exercise, it's really very difficult to then suddenly change, whereas this nice gliding, ramping up is really very beneficial and allows us to really get the maximum amount of stress that we can in a very safe way for the patient. While it is thought to be a CVS protocol, it actually has emanated out of Stanford University in the United States. So it is a validated number of protocols to overcome these perceived shortcomings of the Bruce protocol.